In addition to providing comprehensive diagnostic imaging services, Medical Imaging Center of Southern California and Dr. Brad Jabour have pioneered techniques in functional imaging, allowing you to see the thinking brain.
A very dear friend of mine is Dr. Bradley Jabour. He is the world's leading neuroradiologist with more than 20 years in practice. He is an expert on the impact of drugs such as heroin on the brain. Please welcome Dr. Bradley Jabour. Good to see you.
This is the powerful tool that MRI has created this image of his face, and we're going to create a window through that and look at his brain. You can actually recognize him, and now we're looking at the wiring mechanism in the brain. Just like a computer, there's multiple wires connecting the different servers in the brain networks. Okay. So we were able to get a good window into the brain and evaluate that wiring mechanism.
Okay.
On this image, what we're looking at is the engine of the brain, how the brain is working. And we can see on the normal brain, in a normal patient, that engine is working. Red means good functioning engine. And here on Tyler, unfortunately, in this region, we don't see much of that engine activity.
Okay, so what we're looking at here is an absence of blood and oxygen flow to this part of the brain, and this is the executive function area, correct?
Correct, yeah.
So what impact would this have on Tyler in terms of cognitive domains, behavior, emotion, all of that?
This controls your impulses, your ability to control anger, your ability to plan and set your life on a track, short-term and long-term goals. All of that is disrupted. On this image, there are multiple images through the brain slicing through. I picked one that shows one scar. It's an area of gliosis or damage to the brain, and there are many of those throughout Tyler's frontal executive area. It's like pouring acid into a computer. You're going to destroy those wires, and you're going to destroy the microprocessors and chips in that computer.
Why don't you just take my chair, Dr. Jabour? This can affect planning, memory, reasoning, long-term planning. It affects all of those sort of things. It can affect motivation. Your image of pouring acid in a computer is really good. It just messes everything up. Can we have the next image? These images here are showing what, Dr. Jabour?
So that is, the green represents what the normal brain looks like. Nice focal area in the front of the brain, and in the back there's the self-referential area where you understand who you are in the world, is that green in the back. In Tyler, you see that in the front, that activity is its hyperconnectivity represents this dysfunctional frontal executive limbic complex. So he has at least twice as much activity, maybe 3 times. And this gives us a platform to view him with time and see if his baseline here can improve as he hopefully gets into a rehab situation.
For more information, go to www.micsc.com.